feeling like you're maybe wading through just endless information when it comes to healthcare quality and safety.
Yeah, it can be overwhelming.
You're definitely not alone.
Mm-hmm.
So for you, we're diving deep into the essentials today, really trying to cut through the noise, bring you what truly matters.
Mm-hmm. And today, we're sort of on a mission, you could say, to understand the critical role of healthcare accreditation,
Right.
Our focus. Two major players, Joint Commission International, you might know it as JCI, and the National Accreditation Board for Hospitals and Healthcare Providers, NABH.
Exactly. And we've sifted through quite a bit of information directly from JCI and NABH themselves. Also insights from Supremediq consultancy.
Okay.
The global perspective from ISQA, that's the International Society for Quality in Healthcare.
ISQA.
And we even looked at the nuts and bolts of writing effective audit reports.
Yeah.
So quite a mix.
Yeah, a good range. So what we're going to unpack for you is what these organizations actually do, on the ground, why their stamp of approval, that accreditation, why it carries so much weight.
And how it all fits together.
And how this all contributes, hopefully, to making healthcare better for everyone.
Okay, good. Let's start by looking at JCI and NABH then. JCI. It's a really significant global organization, isn't it?
Oh, definitely. They're known as a leader in making sure healthcare is high quality and, crucially, safe for patients.
And they've been at it a while.
Yeah, over 2 decades, operating in more than 70 countries now.
Wow, 70 plus yet.
And they've accredited over, I think it's 1,000 programs worldwide.
1,000, okay. And their goal, what's the official line?
Their mission is pretty straightforward: to enable and affirm the highest standards of healthcare quality and patient safety for all.
Enable and affirm. Okay.
And what's really fascinating, I think, is the real-world impact. What hospitals actually say about JCI accreditation.
Ah, right. What kind of benefits do they report?
Well, some really significant ones. Things like better teamwork among your staff.
Okay, that makes sense.
Valuable learning opportunities that come just from going through the whole accreditation process.
Right. It forces you to look closely at things.
Exactly. And even gaining a competitive edge in the market.
Interesting. And does it help with how the public sees them?
Yeah. Ultimately, this can lead to greater confidence from the community in the care that's being provided.
Right. And it's not just about, getting a certificate to hang on the wall.
Not at all.
Hospitals have also highlighted, haven't they, that JCI accreditation helps them manage risks better.
Absolutely. Managing risks more effectively, strengthening their focus on making patient safety a real priority.
Building that culture of safety.
Precisely. Building a culture where patient safety is front of mind for everyone. I think it was Alex Lan from Hong Kong Adventist Hospitals who described the accreditation process as a fantastic team-building exercise.
So, yeah, it might seem like just paperwork from the outside, but what this really translates to for you, the listener, is a healthcare provider that's demonstrably committed.
Committed to not just checking boxes,
Right.
but actively fostering a safer and more effective environment.
And JCI gives them the tools, the framework.
Exactly. They provide a strong framework to help hospitals actually achieve this. They develop what they call rigorous international standards for quality and patient safety.
Okay, these standards.
And they also have their international patient safety goals.
Ah, the IPSGs. I've heard of those.
Yeah, they're like a crucial checklist almost and a guide for healthcare organizations to measure how they're doing and, importantly, where they can improve.
And beyond just the accreditation itself, JCI seems to offer quite a bit of support, don't they?
They do, yeah. It's not just pass or fail.
What kind of support are we talking about?
Things like patient safety pathways, specific advisory services to help hospitals get ready for accreditation.
So hand-holding almost.
In a way, yeah.
Yeah.
Help with quality management, infection control, handling medications safely, even making their physical facilities safer.
That's quite comprehensive.
It is. And they also offer specialized training focused on high reliability.
High reliability, making sure things don't go wrong.
Pretty much. Making sure systems are designed to prevent failures. Plus, online tools and a whole range of publications like books and newsletters.
So it shows they're really invested in supporting that ongoing continuous improvement.
Exactly. In all sorts of areas within healthcare.
Okay, now let's switch gears slightly. Let's turn our attention to NABH. That's the National Accreditation Board for Hospitals and Healthcare Providers.
Right, NABH.
They're described as a constituent board of the Quality Council of India. What does that actually mean?
It essentially means they're a dedicated arm, within this larger quality organization, QCI.
Okay.
And NABH is focused specifically on healthcare accreditation, but within India.
So their scope is national, not international, like JCI.
Primarily, yes. They were established to run accreditation programs for healthcare organizations right across India.
And their main aim?
It's really to set standards, benchmarks for the healthcare industry in India to improve, while also ensuring they operate independently with functional autonomy.
And I read something about a consumer focus.
Yes, and that's really important. NABH has a strong focus on meeting the needs of patients, the consumers of healthcare.
Which reflects that broader global shift towards patient-centered care.
Absolutely. Understanding patient rights, putting the patient first. It's key.
Now, we also came across Supremediq Consultancy. What's their connection here?
Yes. They seem to be a company that provides support services to hospitals, specifically mentioning help with achieving NABH accreditation.
So, like consultants guiding hospitals through the NABH process?
It sounds like it. Offering support from the very beginning, the planning stages, right through to ideally getting that final accreditation.
Their approach, what's their philosophy?
Well, their approach seems interesting.
Yeah.
Supremediq believes in helping hospitals reach their goals by putting in place best practices.
Best practices for what?
For managing their operations and ultimately for getting better at what they do, improving performance overall.
Okay, so we've got JCI, the global player, NABH focusing on India, and consultancies like Supremediq helping hospitals meet those standards.
That's a good summary so far.
Now, let's bring in another key player we mentioned, ISQA. Where do they fit in this picture?
Right, ISQA, the International Society for Quality in Healthcare. They're a bit different from JCI and NABH.
How so?
Well, firstly, they're a member-based, nonprofit organization. Global reach, definitely.
What?
And for over 30 years, they've been dedicated to helping improve the quality of healthcare, globally.
So wait, they don't actually accredit hospitals themselves then, like JCI or NABH do?
That's right. No, their focus is broader, much broader, actually.
Broader in what sense?
They concentrate on things like providing education and training and quality improvement.
Okay.
Sharing knowledge and best practices from all around the world, offering external evaluation services for entire healthcare systems, not just individual hospitals.
System-level evaluation.
Exactly. Supporting health systems on a larger scale. And really importantly, connecting healthcare professionals. They have members in over 70 countries.
So it sounds like they're trying to build a global community, a network focused on quality and safety.
That's a great way to put it. What's their main goal, their mission?
Their stated mission is to inspire and drive improvements in the quality and safety of healthcare globally. For everyone, everywhere.
Inspire and drive improvements.
You could almost think of them as fostering a global learning network, specifically focused on making healthcare better and safer.
Okay, so if JCI and NABH are maybe like the referees setting the rules and checking compliance, ISQA is more like the coach, or maybe the league commissioner, helping everyone learn and play the quality game better.
That analogy works, I think.
Yeah.
It clarifies their distinct role.
Okay,
that makes sense. Now, let's switch gears again to something really practical.
Okay.
Audit report writing and communication. It seems like all these accreditations, all these efforts to improve quality, they depend quite heavily on effective audits, right?
Oh, absolutely. Audits are completely essential. They're how you see where things are working well and, maybe more importantly, where improvements are needed.
But the audit itself isn't enough?
No, not by a long shot. Audits only lead to real change if the findings are documented clearly.
Right.
And then communicated effectively to the right people. A well-written audit report is really the foundation for making those improvements actually happen within a healthcare organization.
Okay, so what are the main reasons? Why are these audit reports so critical?
Well, several reasons. Firstly, they create a record, a paper trail.
For accountability.
Exactly. They track and document the entire audit process. This is crucial for transparency and also for showing compliance, proving you're meeting the requirements of bodies like NABH and JCI.
Makes sense. What else?
Secondly, they inform stakeholders. Everyone who needs to know about what was found during the audit gets the information formally.
Management staff,
Maybe even regulators. Thirdly, and perhaps most importantly, they guide improvements. By providing clear, actionable recommendations, not just problems, but solutions.
Okay, actionable is key.
Definitely. And finally, they allow organizations to track their progress over time. You can look back at previous reports and see if things are getting better.
Okay, so they serve multiple important functions. What about the structure? What does a typical audit report actually look like? What needs to be in there?
Yeah, having a standard structure makes things much clearer for everyone reading it. Usually you'll find a title page, pretty standard.
Right.
An executive summary that's crucial for busy people, gives a quick overview.
The highlights.
Exactly. Then an introduction section that explains, what the audit was, about the objective, what it covered, the scope, and how it was done, the methodology.
Okay, setting the scene.
Then comes the really meaty part, the findings section.
What goes in there?
This details whether things were in compliance or not. Crucially, the evidence to back that up.
Can't just be opinions?
No way. Evidence is key. And often, an assessment of any risks involved with the findings.
Okay. And after findings?
Recommendations. This follows logically. And these should be specific, actionable, achievable.
SMART goals, almost.
Kind of, yeah. And ideally include timelines for when they should be done. Who's responsible, too, sometimes.
Right. Then wrap it up.
Usually ends with a conclusion summarizing the main points, and any supporting data, charts, documents can go in the appendices at the back.
Okay, that structure seems logical. But, as you said, it's not enough just to write all this down, is it? Getting that information across effectively is just as vital.
Oh, absolutely. Good communication is what ensures the audit actually leads to action, not just sits on a shelf.
So how do you do that effectively?
Well, first, you really need to think about who your audience is.
Tailoring the message.
Exactly. Are you talking to the doctors and nurses directly involved on the ward? Or the hospital management team looking at the bigger picture? Or maybe regulatory bodies who have their own specific reporting needs?
Right. They'll care about different things, need different levels of detail.
Precisely. So tailor your message, your language, even your format sometimes.
Okay, so tailoring is one thing. What else makes for good communication of audit findings?
Using language that is clear and concise is paramount. Avoid technical jargon or acronyms that your audience might not be familiar with.
Keep it simple.
Keep it simple. Keep it clear. Also, presenting data visually can be incredibly powerful. Graphs, charts, they make complex information much easier to digest than just rows of numbers.
Yeah, a picture tells 1,000 words.
It really can in this context. It's also essential to be honest and transparent in your reporting. Meaning you highlight both the good things you found, the areas of compliance, and the areas that need work. Don't sugarcoat the problems.
Okay, be balanced.
Balanced and honest. And when you make recommendations, explain why. What are the benefits of making these changes?
Well, what's in it for us?
Kinda, yeah.
Yeah.
But also be realistic about any challenges in putting them into practice. Don't just present ideal solutions without acknowledging potential hurdles.
That builds credibility.
It does, and encourage discussion. Get feedback from everyone involved. It shouldn't be a top-down decree. It should feel like a collaborative process for improvement.
So dialogue is important.
Very. And importantly, make sure there's a follow-up plan. You need to track whether the agreed-upon actions are actually being implemented and if they're working.
Closing the loop.
Exactly, closing that audit loop.
You mentioned an example earlier, something about an infection control audit. Can you give us a quick rundown of how that communication might work in practice?
Sure, yeah. Let's say an audit finds that hand hygiene practices are inconsistent in the intensive care unit. People aren't washing their hands properly all the time.
Okay, a common issue.
Unfortunately, yes. And maybe the audit finds that as a result, there's a higher rate of hospital-acquired infections than there should be based on benchmarks.
Right, a direct consequence.
So the audit report would clearly detail these observations, maybe specific times or situations where hand hygiene failed, and present the hard data on infection rates. The recommendations might include things like, say, mandatory refresher hand hygiene training for all ICU staff.
Makes sense.
Putting in more hand sanitizing stations in convenient locations, and maybe doing quick monthly spot checks or mini audits to see if compliance is improving.
Got it. So how do you communicate that effectively?
Well, you'd present that data and the specific recommendations to the relevant stakeholders, the ICU manager, the nursing staff, maybe the infection control committee.
Okay.
You'd emphasize the direct link. Inconsistent hand washing leads to these infections, which harm patients. You might use a graph showing the trend of infections over time to really highlight the urgency.
Make it visual, make it impactful.
Exactly. And you'd frame the recommendations positively. Here's how we can fix this together to protect our patients. Encourage their input on how best to implement the training or place the sanitizer stations.
Collaborative problem solving.
That's the goal.
And you mentioned something called the 5 C's of effective audit reporting. What were those again? Sounds like a useful checklist.
Ah, yes, the 5 C's. They're helpful principles to keep in mind when writing and presenting reports. They are comprehensive.
Meaning it covers everything important?
Right, covers all the key areas and findings. Then clear, using language that's easy to understand.
No jargon.
No unnecessary jargon. Concise, getting to the point without fluff or rambling.
Respecting people's time.
Exactly. Consistent, using a uniform format, tone, and terminology throughout the report, and maybe across different audits too.
Okay.
And finally, and maybe most importantly, constructive, focusing on how things can be improved rather than just pointing out problems or assigning blame.
Comprehensive, clear, concise, consistent, constructive. Got it.
Very good guide.
Okay, so to sort of wrap up our deep dive here, it really sounds like getting accredited by organizations like JCI for the global standard or NABH in the Indian context. It's a really significant sign, isn't it?
It absolutely is. It signals that a hospital or healthcare organization is genuinely serious about providing high quality and critically safe care.
It's a public commitment.
A very public and verifiable commitment. And these efforts, they aren't happening in isolation. They're supported by international groups like iSquad.
Right, the facilitators.
Who help share best practices, foster learning, and connect people working on quality improvement all around the world.
And underpinning all of this, making it actually work on the ground, is the process of auditing.
Yeah, at the heart of making all this quality machinery function is the audit process. And as we discussed, well-written audit reports coupled with clear and effective communication of what's been found.
The 5 C's.
Right, using those principles.
Yeah.
That's absolutely crucial for driving continuous improvement.
And that continuous improvement is what ultimately leads to better, safer healthcare for everyone. For you, the patient.
That's the end goal.
So, considering this global focus, this real push towards making healthcare as good and safe as it possibly can be, what final questions does this raise for you, our listener? Maybe think about the role of accreditation in ensuring you receive the best possible care. Does knowing a hospital is accredited change how you feel?
That's a good question to ponder.
Or perhaps consider how these standards, JCIs, NABHs, might need to adapt in the future. What new challenges are coming in healthcare that accreditation needs to address? Something to think about.
Definitely food for thought.
Thanks for exploring this with us in this deep dive.